Welcome, everyone. Good afternoon and good morning, and thank you for joining us today. This is Dr. Barb Fisher. Before we get started, I want to remind you that this is a listen-only call, which means that I am unable to hear you. If you have any questions as we move along in our call, please reference the box that you should have on the right side of your screen that would have popped up when you logged in. That box will allow you to send questions over to me instantly, and if I am able to incorporate those into my talk at that moment, I will. However, please know that I will address all questions at the end of today's call. If perhaps there is something that you would like to speak to me further about, I will be available immediately following today's webinar. So feel free to call my cell, call my office at 586-323-3620. Again, that number at the office is 586-323-3620. And what we're going to talk about today is the emotional consequences of mild traumatic brain injury, the diagnosis that is difficult to challenge. Now, the reason that I say that is that when you have a diagnosis of emotions, it's very hard for anyone to come in and dispel that and say, well, no, there's no gauge for the emotions. So, for example, I know you're all aware if you do brain injury work, litigation, that there's a thing called an IME. And so the IME, independent medical exam, comes in and says, well, you know, we disagree, we've done other memory testing and the score isn't that bad, and everybody argues over whether it's average, below average, and is that a big discrepancy, etc. But with emotions, see, it's really hard to challenge, because if you can document it and relate it to the person's life and do a nice job in that documentation, it's very difficult to refute. Point being is they have an emotional problem, and if you've done your homework, it's difficult to dispel. I mean, again, there's different measures. Somebody can come back in and say, well, no, I don't see it on this measure, which would be the MMPI that I'll be talking about later, which is mostly a forensic measure. But if you've done your homework and documented it well, it becomes difficult to truly dispute an emotional problem. And my experience with that is that people really don't. So one of the wake-up calls and the purpose for this seminar is that when people have a traumatic brain injury, they do have emotional sequelae associated with that injury. And so the point is to be aware of that and to track that, because that can become a very important part of the case. It's also important to track that in all consciousness and being conscientious, because it really dramatically affects the family and it impacts the person's life. So there's a dual purpose to the importance of emotional changes following traumatic brain injury. So our objective today, as you can see on the screen, is that we're going to talk about the emotional changes following a traumatic brain injury, how you document those emotional changes, the impact on cognitive neuropsychological test results that we found, what is the impact upon the family system, and then, of course, what are the treatment needs of the individual with regard to these emotional changes. So the emotional changes following TBI, you're going to hit the right frontal processes. Now, what does this mean? Well, we're talking about the frontal processes, which is basically the frontal area of the brain. As you well know, that is the largest brain area, occupies approximately 40% of the brain, and the frontal area of the brain is the seat of civilization. The left frontal area of the brain is more involved with cognitive function, and the right area of the brain is more involved with emotional function. And so the right frontal processes become the cornerstone of self-regulation. And there are three critical issues involved. And this is the first one. It's the implementation of a guidance system for behavior. In other words, it's the right frontal area of the brain that provides the internal drive state that says, okay, you're going to stick with this goal because that's the goal you decided upon, and you're going to follow that through. When that guidance system is defunct or it has problems, then they're going to be driven by the moment. So if you see children and they see something and they feel like it and they do it, what do we call them? We call them impulsive. If they see something and they feel like they want to do it and that means running around the room, we may label them hyperactive. With adults, what it would look like is they would do things without thinking. They would sell a car without thinking. They would buy something without thinking. They would say something without thinking. They would do socially inappropriate behavior without thinking. We've had countless stories of people, peeing in public or making sexual advances. These are not new things. With dementia, you'll see that. And the reason you see that with dementia is that one of the areas that breaks down with dementia is the frontal area of the brain. So as the frontal area of the brain breaks down with dementia, then you see the person being more impulsive and going back to behavior that they would have learned a lot earlier in life to basically repress. So the second thing of the right frontal processes is social emotional intelligence. When do you do what? An awareness of what to say when, how you carry yourself, that you're able to pick up the nuances, the nonverbal impact of what people's reactions are, and to put that together with what's going on in the room to be able to have a whole perspective, the ability to have empathy. There's a lot of information on social emotional intelligence, and the more successful people are, research has found that they have a higher levels of social emotional intelligence. So again, this is part of the right frontal processes. So when this breaks down, what happens? Well, you lose a sense of self. And there's a lot of research that came out several years ago by Dr. Miller talking about the loss of the sense of self when there is damage to the frontal and temporal areas of the brain. Well, what are the two areas that get damaged most often in TBI? The frontal and temporal areas of the brain. So the new buzzword that has become as a result in the TBI circles is the loss of the sense of self. And that is the paramount critical emotional change following a TBI that needs to be documented. There's a loss of the sense of self. But what is this loss of sense of self? It's a loss of your values and what made you tick and what was behind making decisions and the internal belief system that the individual has that carries them through their lifetime. And based upon that, they make decisions upon the way that they react to people, upon the way that they conduct themselves, upon their goals for their own life. And so when people lose their sense of self, they no longer have a sense of who they are and what they are. And that's, again, what the research talked about. And the third thing is, the cornerstone of self-regulation. The third issue of the right frontal processes is these symptoms that are described here. So when this area of the brain is compromised, then you're going to see what? You're going to see somebody being very irritable, impulsive. They don't think about things. They just do it. They can't understand or predict the impact of their behaviors. They don't get the big picture. And again, a lot of these would tie in with cognitive deficits of integration. So if you have a problem with integration, you don't get the big picture, you're not going to see how your behavior is going to impact someone. They're hedonistic. They live in the moment. They just feel like if they do it. They lack an internal drive state. It's not internalized. In other words, they're very impulsive and they're living basically in the moment with what they want. They're driven by minor irrelevancies of the moment, and they have inappropriate habits and routines. And there's many, many case examples that those of you who have been in the seminars I've talked about before. The one that really comes to light about this situation was a young man who ended up having an abscess in the right frontal area of his brain. And the abscess had gotten so bad that it occupied most of the right frontal area of the brain. So when they went in to do surgery, by the time they got done and clean up the problem, he didn't have much of the right frontal area of the brain left. And this young man, who had been planning to marry this girl of his dreams for years, who at this point, this girl was having his baby, decided he didn't want to get married. He was running around TPing people's houses. He spent his time playing video games and basically never went forward. And it's this type of situation that I cannot begin to tell you the impact when right frontal processes are involved. Like there's so many case examples of people where you'll look at the test scores and you'll say, this isn't all that bad, and yet they can't function. We had another girl who had a stroke and had a right frontal injury, and she could not maintain employment as a lunch aide. As a lunch aide, she couldn't maintain employment because she just reacted to everything. She felt hot and she ran out of the room and left all the kids sitting there. And despite the fact that people were telling her over and over, you're responsible for these children. You can't leave them unattended. They were elementary school children. When she got hot, boy, she was out of the room. So despite the fact that her test scores were really pretty good, I mean, she was brilliant and she had scores in the gifted range, she could not function in life. So again, I can't emphasize how big of an issue this is, even though the person looks on the outside like they're doing pretty good. So what are these emotional changes that take place? And again, the frontal area of the brain is pretty well going to be at the root of this in what I just described. You're going to see personality changes. People will adopt an old personality. You have somebody who is an alcoholic. And again, we see this a lot with aging, so it's kind of a good picture to keep in your mind to get a sense of it, because if we can draw a word picture, it's easier to get things. So if you think about a person who is getting dementia and they were an alcoholic and then they went through a period when the kids were growing out of the house and they became so nice and mellow and they weren't anything like they were when the kids were growing up, and all of a sudden they're back to ranting and raving and reacting emotionally and getting red in the face and just having a fit about things, and people are so surprised, but the brain is breaking down frontal lobe, and so they adopt old personality characteristics, and all the abusiveness and the judgmentalness and the reactivity comes back. When the emotional changes, again, another hallmark issue is that there's an emotional response to ordinary events. There's an overreaction, and there's no rhyme or reason. You can't predict it. We see this with children all the time. When children have an injury, I mean, they'll do something, and it's like there's no way anyone could ever predict it. There's no way anyone could ever figure out why they did it. They just did it, and and the same is true of adults. And so when you see that, again, these are questions that you would ask the family members or the spouse to gather information, because these are very pertinent issues, that they have this emotional response that comes out of nowhere. And then they won't give it up, see? So they have this emotional response that doesn't fit and doesn't make any sense, and yet they're not going to let go of that either. And it makes it a very, very difficult person to deal with. We recently had an individual who had a number of cardiovascular issues, and as a result, of course, his frontal area of the brain was compromised, and he happened to have normal pressure hydrocephalus, which was in, of course, the right area of the brain, so his right frontal process were definitely compromised, and he would just get angry and start swearing out of nowhere. He was a wonderful person before this event occurred, and was actually fired from a job at a recreation place because of his inappropriate behavior and his reactivity. And of course, the marriage is suffering terribly because he just reacts out of nowhere and just gets so upset about things. Social interactions become problematic due to this emotional ability. Think of children where they react and they grab something from somebody and they won't let go. And we had this one little boy a long time ago who had a head injury where both sides of the frontal area of the brain were severely impacted, and he got attached to this crayon in school, and it was this special turquoise crayon, and he had to have that crayon. So when the crayons were being passed around, he would run over and grab that crayon, and one of the other children would say, well, I want the crayon, and he wouldn't let them have it. And of course, this big issue emerged from that, because this child was not giving up his crayon. It was not happening. So the point in my message is, not only do they have this overreaction, but then they're stuck. They perseverate in this reaction, and you can't get them to shift. So again, it all has to do with right frontal processes. So social interactions become a huge issue. If they're developing paranoia, they're going to have a fear of people. They're not going to want to go out. And also, because of the changes in the brain, they may have a reaction to noise and people. One of the disorders that comes out of that is called schizoaffective disorder. It's a fragileness in the brain combined with depression. So it's not unheard of to see a schizoaffective depression or disorder emerge following a traumatic brain injury, because the brain becomes more fragile, they become more paranoid and suspicious, and then, of course, if they're depressed prior to the injury, it deepens and then would create this disorder. And the key issue about schizoaffective depression is that they really just do not like people, and they don't tolerate people very well at all. So again, more emotional changes, the way that they use their free time. So if you have a disorder like this brain, they're going to closet themselves in the house. They're not going to go out very much. They're not going to want to be associated with people as they become more suspicious and more paranoid of people. In spontaneous conversations, when you're interviewing someone who's had a TBI, if their conversations are tangential, it's like all of a sudden they go off and they're talking about something totally different, and you're thinking in your head, where did this come from? You want to think about that, and if they do that a lot, that could very well be heralding the changes emotionally within the brain. And again, as we talked about, the loss of sense of self and the values and beliefs that are lost. And so a person's whole life can change in a matter of seconds of time. So you have a few seconds to create an injury, and then their whole life changes as to where they're going and their direction and what their goals were and what they were going to be as a person, or even regaining what they were as a person, and really get a sense of the impact of injury to the brain on the emotional system. So the ability to interact with peers in the workplace, it's not safe for coworkers due to reactivity. And we had an interesting a case where this woman, actually, again, her test scores looked very good. She had had a head injury by the time we tested her, probably about 5 years prior. And her test scores really looked pretty good. However, she disrupted our whole office whenever she came in, which was a wake-up call that something was going on. And so whenever she came in, she would disrupt the whole office by asking people questions and what they meant by their responses to her and why did they say that. And it could be something as simple as, how are you doing today? And so as a result, when we did the psychological evaluation and all this paranoia came up, you put the two things together of what you've observed clinically in the office, and you can pretty well guess what she'd be like in a work situation. And so we document all of that in a report, and as a result, the judge in this case actually gave her Social Security just based on that, because she was so vindictive and so reactive and so crazy in terms of her predictable emotional reactions that there's no way that the judge would submit a workforce to her, not so much what they would do to her, but what she would do to them was the case. And so again, that's another wake-up call to the impact of emotional changes. So how do you track these emotional changes? We're going to do a full psychological evaluation. I'm going to talk about that in a minute. You want to compare it to pre-injury function. It's very important. You want to interview family, friends, children, and relatives, and also complete work evaluations. Look at work evaluations as well. Case in point for this is that we had one case where this young man had an electrical injury, but it had hit the thalamus, and the thalamus is the relay center for any information getting up to the brain. And long story short, he had a lot of frontal issues, and he did have a dramatic change in personality. With electrical injury, the problem gets worse as time goes on. So his personality was changing over time, and what we did is we went on site and into his hometown and interviewed all of friends and family and teachers and coaches, and documented all of the changes from prior to the electrical injury to post-electrical injury. And there was a huge change in his personality and how he functioned. And so we got just a wealth of information to document the changes. Another case in point using work evaluations was a 50-year-old woman who got involved in a car accident. This car accident occurred after she had had a tumor removed, a good-sized tumor removed from the temporal area of her brain. So this woman had a tumor removed from the temporal area of her brain, the memory area. And then, of course, she had seizures following that. And so she was being treated for seizures by her treating neurologist. And then she returned to work. And her work evaluations documented what she was like before the tumor, and then what she was like after the tumor. And then the work evaluations documented how she functioned and how she worked so hard to regain her former status and relearn her job position, and how she just did a phenomenal job because we watched her ratings go up this post getting this tumor, having the surgery for the tumor. Then in comes the car accident, and then you see the work evaluations document the difference between the gains she had made following this surgery and then the decline following the accident, which resulted in her having to leave her job position. And so it was a great case that documented, using work evaluations, the impact upon her functioning. And one of the major issues was her emotional changes. And that, in addition to cognitive changes, her emotional changes in her reactivity to people, and she would just get angry all the time. When she first came in for an evaluation with us, she sat down and said, I don't know why I'm here, and who are you? So those were the kinds of issues that were going on at work. So again, these are different ways that you can track emotional changes. The evaluation and documentation of the emotional changes are what I'm going to talk about next. And again, we do a full psychological evaluation that most people don't do anymore. It's the old gold standard of evaluations. We're doing projective measures, which are the Rorschach, the House tree person, and the TAT cards. The Rorschach are the famous ink blots, the House tree person are the drawings, and the TAT cards are cards called the thematic apperception test, and they're drawings that somebody looks at and then they tell a story. Now, these projective measures are never used in court. They are not admissible in court. However, they form the gold standard backdrop to the personality assessment that can be used in court. And we will document in the report that we've done projective measures. We don't go in depth to that effect. But again, following the gold standard, it's very important to do projective measures because you will get schizophrenia, you will get paranoia that you will not get on the personality assessment. For example, there are countless occasions where on the personality assessment, and the one that we like to use is the Milan, the MCMI, you'll get a readout, and because someone's paranoid, what do? They don't answer questions. Yes, they answer them all no because they're fine, because they're not going to admit anything. So you get this personality readout that says that they're really fine, and when people don't answer, when they answer all the questions that they're fine and they mark no to everything, then it reads out a certain specific way. And so you get that, well, you can't use that. So then you go to your projective measures, which tells the whole story. Then you do your documentation of interviewing people and doing your history, and then you've got your case. But without those projective measures, you wouldn't have that. So even though they are not admissible in court, they are very much used in the process. And the reason why they're not admissible in court is because they're so subjective. So they're not a standalone measure. They're simply used to provide more information that you really have to document with the history and everything else. A case in point to that is there was an individual that we tested many years ago, and he filled out these self-report measures, and the evaluation took a longer period of time because he was sick in the middle. At any rate, what happened is he ended up filling out 2 sets of these self-report measures, and that's what we use as well, and we use the Beck depression inventory and also the Beck anxiety inventory, quality of life scale, etc. And there was actually a difference in the way he filled out these measures during the lapse of time as the injury was worsening. So it was another way to document that there were changes going on as a result of the TBI emotional changes because his emotions were getting deeper. There's always a deepened depression. There's a deepened whatever the person had before the injury becomes deepened following the injury. And over time, it gets worse because the cellular changes within the brain that follow TBI. So as a result of these things worsening, the emotions become brain-driven or deepened emotions that are not very receptive to therapy. They're also not terribly receptive to the typical medication that's used, which would be the antidepressants. So again, that's another way to document, because usually people will come in on antidepressants and you're still seeing all of those deepened emotions. So what you know from that whole story is that basically it's not making a dent in the problem, and in all likelihood, once you've done the rest of your documentation, you're talking about a deepened brain-driven depression. The personality assessments, we like to use the Milan, which is really user-friendly. It has a nice readout, but again, that's a clinical assessment. If it's a forensic evaluation, you do have to use the MMPI. Your MMPI should always be scored forensically. If anyone does not score it forensically, then that's technically not admissible in court. It should always be scored forensically. And then you get information from the MMPI, but because it's forensic, it's a forensic exam, it really doesn't yield much information. When you're trying to figure out the person, you're going to get that from the Milan. So as a result, we do both. And then, as I indicated, you do a review with the family and also the patient. So the impact of emotional changes in neuropsychological test results on the cognitive process. And we recently had a great example, which I might have mentioned on another webinar, and that was this woman that we had known for probably 5 years and done testing on 5 years prior. And she came into the evaluation. She had had a head injury and she wanted to be evaluated actually for Social Security. And the evaluation took 3 times as long as it normally would. She left the office in tears, upset with the evaluation, and that's really a rarity because, usually we're pretty user-friendly and people really don't mind being evaluated because, we kind of make it a nice atmosphere. And so we were shocked because usually people don't mind our evaluation, but she left with this headache and she didn't want to come back. And again, that's not the usual thing. So we sat down with her, and what it turned out was that she was using all of her effort to complete these tests. Now, the problem was twofold. As a result of using all of her effort to complete these tests, it didn't show her deficits. She came out fine because she used everything she had to complete these tests. And that's why she was so exhausted when she left. But she was doing that because over the course of time, and we had done a prior psychological evaluation on her, she had become paranoid. Because as the frontal area of the brain was breaking down as a result of the TBI injury, and the more paranoid she became, the more she said, well, I don't want anyone to know me. I want to keep everything protected. I want to keep a wall over me, and I want to look great. Well, she sure did with a lot of effort. So again, it's important to keep that in mind, that when you have that paranoia operating, that person is going to be locked up tight, and they are going to want to appear perfect. So they're not going to tell you there's a problem on any self-report measures. They're not going to tell their physician there's a problem, and we have this happen all the time. They go off to the neurologist, and they go, oh, yeah, I'm fine. And of course, you're looking for the neurologist to document a head injury. The neurologist can't document a head injury because they're reporting that they're fine, of which we had a recent case example of that. So the more paranoid they get, the more that they have a lockdown and they have to appear intact. Well, it's hard to help somebody who's so busy convincing you that they're really okay. So it's important to remember that. They can become more obsessive compulsive on the testing, where they have to do everything so well. Then what happens is you end up with a time factor. So how valid are your test scores when the person has a test-taking attitude of being very slow to complete something? And of course, it's timed. How much can you do in X amount of time? So how well are your measurements? So that's an issue too. And then you have this emotional ability and this reaction. And we had this one lady who the right frontal area is just really emerging in the testing and the psychological issues. She also had an EEG that was pointing to that as well. And when she first came in, I mean, she was just, I don't want to be here. I don't know why I'm here. She came in like 9 months post-injury, and she came in because actually she had started to make a number of mistakes at work. She was an accountant and started to cost the company, and she was scared. But she reassured us she had no head injury. She didn't want to be here. Not that she didn't like us, but she wasn't sure how she felt about us. And so we spent the first 3 or 4 sessions not doing any testing, just having conversations with her so she got to know us, because all of her emotional ability negated doing any testing. Because any testing that we did would have been basically impacted by her emotions, and it wouldn't have been a valid measure of what she could do. Impulsivity is going to carry the same response. People are impulsive and they're responding impulsively. Your test will not measure what it's supposed to measure. And depression as well. If somebody's depressed or they're in pain, again, you're going to have a slow psychomotor response if they're depressed. That's going to affect your time testing. And if they're in pain, the same issue is going to take place. I mean, if you think about, having a headache every day and you're in excruciating pain, it's going to be hard to take these tests. So anyone who's doing neuropsychological assessment has got to take that into consideration. You always have to ask the question, did the test measure what it was supposed to measure, and are these emotions impacting the testing? So now I'm going to talk about how the emotional changes affects the family system. And again, it impacts the family system depending upon a number of different variables. So what is the person's role in the family? Well, if you have a mom who's had a head injury, they're going to tend to have a bigger impact on the family, because mothers, even when they do work, are still filling that dual role of being the maternal object, the person who's taking care of the caretaker, emotional caretaker of the family, in addition to working, versus the father. So they're going to have more of an impact. Your variables would be the age of the children and their developmental needs. Depending on where they are in the developmental process depends upon the degree of impact that the changes, emotional changes in the parent from the TBI are going to have upon the family. So that would be the adult child who's basically moving out into the world versus adolescents versus elementary versus preschool children. So it all becomes a hierarchy with these variables depending upon which parent is affected and the timing of the TBI among the members. And so let's take a look at the developmental needs of the children. So basically you have adult children, and if they are looking for their mother or their father, and generally it's going to be the mother first in terms of the maternal object, to be taking care of these newborn babies, but mom has just had a head injury and mom's not available, or mom is severely depressed and not available to do anything. The more direct impact, of course, is going to be when the parent has a head injury and and it has to do with the home environment. And a case in point is another case that we've had for the last 2 years involving a male who had a head injury. He hit a deer going 70 miles an hour and had a huge head injury, and his personality changed. And what it did is it exacerbated or increased his tendencies pre-injury. And his tendencies pre-injury would be to be an individual who got angry a lot. He was subject to rage and fits, overreact, very emotional, hysterical. The world revolves around him because he had some borderline personality qualities prior to the injury. And the definition of borderline personality is it travels the borderlands. So that person can look wonderful and they can look crazy and they can look rageful out of nowhere. But of course, the key issue is they twist and turn their words, and that's why they are the ones who start all the lawsuits. So those were his qualities prior to this injury. So he has this injury, and all of this is deepened. So now the children, and they've got a 2-year-old, and they've got an 8-year-old and a 10-year-old, are terribly impacted by this. And of course, the oldest is impacted the most because daddy's very different. So the children go to school and they start talking about their dad being, very different. They don't know who their dad is because this dad is now either, absent or not involved, and he's also having a lot of seizures at the time, or rageful or angry or causing a ruckus in the household. And before, he had been the stay-at-home mom. So it had a huge impact upon the kids and their stability. And the marriage, it's very hard for marriages to stay together and weather the storm, whether it be the child that has a head injury or the spouse that has a head injury. And so the marriage has been, throughout the course of 2 years that we've been seeing this couple, and my staff has been, the marriage has been in disarray because it's up and down. It's always on a roller coaster from whatever is going on. And so you get these continuous phone calls of he's accusing her of adultery and he's accusing her of doing this or that, the other thing, because she actually talked to someone. And at the same time, he's having all these reactions as well, emotionally. And so it's really had a huge problem in terms of the family. So with preschool, their needs are that they need a lot of consistency and stability that they're not going to get if one of their parents is more emotionally labile. For the elementary school children, they need, from the parents, they need to develop values, moral and cognitive development. There's going to be more schoolwork and things, and if one of the parents has a traumatic brain injury and they're having all these changes, of course, that's going to impact their development. For adolescents, their big issue is that they need guidance, and they become more reactive and lose their own sense of self. It is pretty common that an adolescent would react to one of the parents who's changed and said, I'm going to be exactly the opposite, and so you have people reacting to reactions. The young adults are probably going to have the least impact because they're already moving towards independence. So the long-lasting effects of emotional changes on their brain, the biggest issue is PTSD, post-traumatic stress disorder. Post-traumatic stress disorder is a very clear emotional reaction to any sort of injury, and you'll hear people talk about flashbacks and nightmares of the accident, and they get in the car and they have an emotional reaction as well, and you will hear that because it's a traumatic event, and the definition of PTSD is anything that happens that no one ever expected to happen. Anything that happens that no one ever expected to happen, and so it's shock. Well, we know from the research from the Holocaust victims that PTSD begets PTSD. In other words, if you have children that are being raised by parents who have the real post-traumatic stress disorder, that environment will create the same changes in the brain that have been measured, and which has to do with the HPA axis and the adrenaline system, will create the same, and the cortisol levels, the same changes, just because they grew up in a PTSD environment. So again, it's another wake-up call to remember about these long-lasting effects of emotional changes from TBI. The other important thing is the impacts of the marriage. There's pressure on the spouse. So the spouse is now, especially if there's limbs that are broken or physically compromised in some way, the spouse is now expected to pick up the slack in the household, take care of the spouse that's injured, and then they're not going to get anything back because that person is not going to be particularly empathetic or considerate of their needs. So it's really a lose-lose situation all the way around, of which the spouse is only going to be able to last so long in that situation. because now the other parent who's not injured has to take care of the children, take care of the household, maintain the marriage, and also provide physical care to the spouse that's injured. And at the same time, they're not going to receive anything back. So you know they're not going to last very long. And then, as we indicated, it impacts the children. So on the person themselves, again, the PTSD, the loss of sense of self, as I described, the problems with relationships, and whether they really have an awareness or non-awareness. And a lot of times when these individuals have a traumatic brain injury, they are not aware. So if we ask, so when asking, we'll ask them, do you see any emotional changes, or are you having any problems? They'll say, well, no, I don't have any problems. It's everyone else. I mean, that's the common response, because they don't see a problem, because their thinking is skewed, and they no longer have an awareness or an appreciation or a concern to have an appreciation of other people. So from their perspective, everything's fine. So what are the treatment needs? Again, the problem with medication is, what kind of medication are you going to help for the emotional issues following TBI? As I already indicated, clinically, and it's pretty commonly seen, the antidepressants aren't going to do much, because it's a brain-driven depression. You may come in and get some help from the antipsychotics, but that's once you've already proven that that's actually happening. And most of what individuals are going to see outwardly is signs of depression. They're not going to necessarily detect signs that the brain is decompensating and then moving towards schizophrenia or loss of reality. So as a result, medication on the whole hasn't had great effects, and it's more common than uncommon that the TBI patient will come in already on medication and still report all of these huge symptoms to you. So what are our options? Well, again, family therapy is very important, and it becomes very important to convince the insurance companies that family therapy is important as a result of the TBI. The same is true of marital therapy and individual therapy. A lot of times the insurance companies aren't very proactive to provide therapy because they're thinking more cognitive changes than emotional changes to the brain. And a case in point, we had one case that dispels what I just said, which is a girl who had a TBI, and then as a result of the TBI, she had a bleed on the brain. And so it hit the right frontal area of the brain. Well, her emotions are just wild. She's totally uninhibited, out of control. And so this particular girl, and she is now 16, the insurance company is very much in favor of therapy. But because the emotional changes so color what's going on with her, they're not in favor of cognitive training. So in her particular case, the emotional changes are so bizarre and so profound that no one is looking at the cognitive changes that have happened, which are tremendous, nor are they concerned with the cognitive changes, despite the fact that she can't pass any of her classes, that she was a very bright student prior to the injury, and now she's in special education, and her reading and grade levels are the same as when they were when she had the injury, so which is about 5 years ago. So everything stayed the same, but no one's looking at what she's doing academically, because in this particular case, the emotions color the terrain so much that that's where the impetus for treatment is. So again, the biggest thing is that you're dealing with brain-driven emotions. So what are you going to really be able to do in the therapy? Well, what you're going to do in these therapies is you're going to set certain limits on behavior. You're going to set up routines, because if it's a brain-driven emotion, you're not going to be able to change that emotion. So it's not going to be your typical talk therapy where you can convince this person to have different thoughts. The job of the therapist at that point is going to be to manage the family system. It's going to be to manage the marriage. It's going to be to introduce behavioral things that can be done on a regular basis to develop a habit and routine, because if you don't develop a habit and routine, it's not going to take place. To develop a habit and routine so that the household functions despite all of these emotions going on. So again, the goal of the therapy isn't going to be to try to change the emotions themselves, because if you understand they're brain driven, you've got to change the brain to do that. That would be our brain training program. The goal of the therapy is going to be to have behavioral interventions to create a life that everybody can live in, including the TBI patient. So again, as I said, that would be the goal of minimizing the damage to job, home, and family. So what I want to do is just finish up with a few slides about what are the stages of emotional development, and then understand that when you have an injury that occurs at that time, what are you going to see? So let's say you have a brain injury that occurs in a child. What are going to be the emotional impact? Well, they're not going to develop any of these stages of moral development, and that's the reason why children who have early injuries, as they age, and especially as they move into adolescence, all of a sudden we're all shocked and go, wow, we don't have any moral values here. And then that tends to be the case. But what I'm going to do is take you through developmental theory, and basically, if you have an injury at a certain stage, then these would be the things that would be affected. So again, in developing emotional moral development, you start off with good girl, bad boy. In other words, children follow rules to avoid punishment. And that's going to be in preschool and elementary school. Then as they get a little bit older, moving towards adolescence, they're going to follow rules to serve their own interests. This is right, this is fair. So you hear children towards the fourth, fifth, and sixth grade saying, well, that's not fair, that's not right, those aren't the rules, So they're going to follow rules based on what they think is fair and right. And then as they move towards adolescence, they're going to believe in the golden rule. They're following rules to maintain law and authority. And then eventually, right as a social system, they follow rules to live up to society expectations. And then, of course, the goal for every individual is that right is based upon their own universal belief, and they develop their own individual ethical principles. So if you take these things, then you say, okay, well, let's say we had an injury at any point. So if we have an injury in the good girl, bad boy stage, well, then they're not going to follow rules to avoid punishment. And that's when parents will report, well, I could punish my child, but it doesn't make any difference because they don't care, and that's true. So if you hit the frontal area of the brain during that time, that's what's going to happen. If you hit the frontal area of the brain during the time of the golden rule, they're not going to follow rules to maintain law and authority because they don't care about that, because what's important is how they feel. They don't really care about whether law and authority is maintained. So, and then the process goes on from there. So again, you need the right frontal processes to develop empathy, to put yourself in someone else's shoes, to have guilt, to have feeling badly that you hurt someone, to have altruistic thinking, to think on a higher level, to be able to have perspective taking skills, to think about the impact upon someone else, same thing as putting yourself in someone else's shoes. And if you have injury to the right frontal processes, you're not going to be able to do that. And of course, that's going to do what? That's going to impact personal relationships. So what do you think happens to these people? Well, they lose their friends. Nobody wants to really be with them because all they do is talk about themselves, or they don't talk about anything that's relevant, or all they're concerned about is themselves. It's the same thing as you say, well, I'm having a bad day, and they say back, oh yeah, so am I. Let me tell you about my bad day. It's certainly not going to foster interpersonal relationships. Self-development, when you have emotional injury to the brain, you're going to affect the development of the self. Questioning their role in life, who are they? Their ability to be intimate versus being more comfortable being isolated from people. Seeing themselves as offering something to the world versus feeling stuck and offering nothing. Feeling positive about themselves versus despair that they have nothing to offer society. So again, to summarize, we've spent the webinar talking about the emotional changes that we don't often think about with TBI. Again, if it's documented, it's a very hard diagnosis to challenge because it is a more murky. It is well known that there are emotional sequelae associated with a brain injury, and so if it's well documented, it can form a very tight case for litigation. And again, it's also important to recognize that there is, and usually is, emotional consequences to TBI that affects not only the individual but their whole entire family system. And it's important to recognize that that's a very big player. So what's unique about our services is that we really identify that, we apply the test findings to real-life situations, we address the impact of ultra-emotional states upon the family, home, and work setting, and of course understanding the impact of the right frontal processes. We produce a very comprehensive report and evaluation depicting the interaction of traumatic brain injury and the cognitive and emotional symptoms. And we document in our neuropsychological testing the impact of emotional symptoms. And we'll redo a test, re-administer a test, re-administer a different version of the test to make sure that we have handled that situation and our tests measure what they are purported to measure. So what we offer at United Psychological Services is a comprehensive treatment report as a team effort of specialists with detailed suggestions for intervention. We have a team of specialists who have been involved with brain injuries for 20 years or more. We manage the TBI case interfacing with the specialist, primary care physician, school setting, work setting, and the attorney. and develop a specific therapy and brain training program that can be implemented in the home. We address therapeutically the emotional impact of the TBI with the patient and their family. Our evaluations are comprehensive. Do a comprehensive psychological evaluation, a comprehensive cognitive assessment. The gold standard, of course, in the neuropsychological evaluation for our forensic report. And we're also always addressing, of course, frontal processes, memory, language, visual, spatial, visual, perceptual, motor, and sensory. For adults, it's very important to look at the onset of dementia. With dementia, the brain training program and also medication makes a huge difference, but you have to catch it early. And again, we always believe that you can make a difference, but the research is clearly showing that the earlier you catch it, the better results you're going to have. So, again, we also want to pay attention to cognitive and achievement assessments for both children and adults, so that we have a sense of who they were and what they were, and for children what they need in terms of their skill set. And this is our treatment team. We have a forensic team, our treatment team, and then speech and language, and a brain trainer, etc., and also a neurologist, so that we approach the individual from a whole perspective. And that's really the goal of our clinic, is to provide one-stop shopping, where we're addressing the individual from all impacts, everything that's going on with them, and we provide a thorough evaluation. So we've made a difference in their lives. Just try and help them with the traumatic brain injury that makes a difference in such a short period of time. Again, we have a forensic team that we have, and if it's a litigation case, that we have people around the country where there's a neuropsychologist, educational specialist, pediatric neurologist, etc. Vocational economics, economist, life care planner, biomechanics specialist, etc. And also PET scan expert, MRI and EEG expert. So you can see all of that in front of you. Again, I want to thank you for your time. I want to wish you a great weekend. And this is United Psychological Services, a multidisciplinary clinic committed to providing testing, diagnosis, and support to individuals dealing with a number of psychological and neuropsychological disorders, emotional as well as brain-based, all in one location, unequal, precise, sensible, for comprehensive testing, accurate diagnosis, successful treatment. Thank you all for participating. We appreciate also your comments that we've received, and we'll be available for any phone calls if you have any questions. And again, I want to wish you a great weekend.